No, never eat ginger again. Never eat ginger again if you have any of these conditions. Take care, because few people know this information. It is well known that many of us are aware of the incredible health benefits that ginger provides. But what few know is that if we have some of the health conditions that I will mention below, ginger is not favorable for you. This video will change your perspective on ginger and how it can affect your health in the following situations. So, if you are between 20 and 70 years old, stay until the end of this video, because this is for you. Before continuing, I would like to ask you for just a couple of minutes of your time to tell you about the incredible benefits we can obtain from ginger, and then I will tell you which people should not consume it. Okay? First, let's talk about the good. Ginger has the first and great benefit of being a natural anti-inflammatory. First of all, anti-inflammatory. Well, I'll take a small pause to ask you to send me some of those floating red hearts, please. One person can send 10, 20. Throughout the whole video, gift me those floating red hearts. They're over here. Make the video bigger. They're over here. Sakur you. Thank you very much. Well, I don't know if you know what inflammation is. I've explained it to you in other videos of mine. Inflammation is when a part of your body swells up, to put it in some way, okay? So that's when you need an anti-inflammatory, a natural anti-inflammatory like ginger, for example, okay? Ginger acts against with against prostaglandins, which are the substances that cause inflammation and pain. In short, the gingerol in ginger acts like a little bodyguard for your organism, preventing an inflammatory uproar in your body. Do I make myself clear? So, against inflammation. So, if after training, after having a very intense workday, or due to those age-related aches, if you feel inflamed, in pain, a ginger tea can help you reduce those discomforts naturally without having to resort to medications that sometimes come with side effects. Nature has given us the gift of ginger so that our muscles, our joints, feel a little less tortured. Let's talk about the second benefit. Ginger is also a very good ally in digestion. The second benefit, but not the least important just because it's second, is that ginger is fantastic for putting your digestion in order. I would like to quickly explain what's behind this. Ginger stimulates the production of saliva and, as a consequence, stimulates gastric juices. This helps food break down better and nutrients are absorbed more efficiently. Okay? Additionally, its compounds help relax the muscles of the gastrointestinal tract, which contributes to preventing colic, indigestion, and discomfort after eating from ruining your day. Okay? Now, let's talk about the bad. What people should not consume ginger. For whom is ginger bad? There is another benefit of ginger before we move on to the bad. It reduces nausea and discomfort. One of the benefits that has brought us the most joy, that has made our stomachs happy, is the antiemetic effect of ginger. What does this mean? It means it helps you fight nausea, whether it's the nausea you get after eating something you don't like, for example, or the nausea that comes from motion sickness when you travel. There are people who even feel nauseous when they have the flu. So, the action of ginger on the central nervous system and the digestive tract promotes the elimination of acid and reduces the feeling of discomfort, calming that annoyance that sometimes prevents you from enjoying life. Imagine that ginger is like a natural painkiller without having to resort to pills, without having to resort to tablets, without having to resort to medications that sometimes leave you with a hangover. And the best part is that ginger, as I mentioned before, is 100% natural and has no side effects, as long as you consume it in moderation and do not overdo it, because everything in excess is bad. Another benefit is cardiovascular health. Okay, the heart. Ginger turns out to be a great ally for our cardiovascular health. How? Well, its compounds have the ability to improve blood circulation and help you level your cholesterol. A very quick action consists of inhibiting the oxidation of lipoproteins. Maybe I got a little technical here, but it's what protects your arteries from plaque buildup that could lead to a heart attack or coronary problems. Additionally, ginger can also help to dilate blood vessels, which promotes blood flow, and if they dilate, it consequently reduces blood pressure. So, if you include ginger in your daily meals without overdoing it, it can greatly benefit your heart if consumed regularly. Okay, next benefit, glucose. It regulates glucose. The benefit I want to mention now is about blood sugar. This is especially interesting for those who are monitoring their sugar levels, whether because they are at risk of diabetes or to generally control their health. What does ginger do? Well, the compounds I mentioned, ginger, gingerol, and their compounds in general, can increase insulin sensitivity and promote better uptake by the cells, preventing spikes and sharp drops that can ultimately affect you. So, ginger modulates various metabolic pathways that facilitate sugar transport and enzyme activation in carbohydrate metabolism. Obviously, right? Well, then let's talk about the bad. What I told you is a summary. Ginger can help you maintain your glucose levels within a more stable range, and this is vital for good metabolic health. Imagine that ginger is like the guardian of your sugar levels, ensuring that those sugar levels don't spike uncontrollably. Well then, there are people who should avoid ginger and people with certain health conditions who should avoid ginger. Although ginger is a great ally for health in most cases, it is not for everyone. There are certain conditions in which the consumption of ginger may not be recommended or even contraindicated. Here, I will give you some people who should avoid ginger and should consume it with caution. First, people who have bleeding disorders or those who are taking anticoagulants. Ginger can increase the risk of bleeding because it has properties that affect blood coagulation. If you are taking medications like warfarin, aspirin, or any anticoagulant, it is better to consult your doctor before regularly including ginger in your diet. That is the first group, anticoagulant. People who should avoid ginger are those who have peptic ulcers or have severe gastroesophageal reflux problems. Although ginger helps with digestion, in many cases there are people who have ulcers or very acute reflux, and this can irritate the stomach lining and worsen symptoms. So be very careful if you have acidity. The following people who should be cautious are those with gallbladder problems. Remember that men also have seminal vesicles, and then there's the gallbladder. We're talking about bile, gallbladder. Consuming ginger could stimulate bile production, and this in certain cases where you have gallstones, stones in the gallbladder, or distension could cause you pain. So, be careful. Now, people with low blood pressure, be cautious as well. If you have severe hypertension, I already told you that ginger dilates your blood vessels. This helps when you have high blood pressure, but when you have low blood pressure, why would you dilate your blood vessels with ginger? It will lower it even more. It can cause dizziness. It can lead to fainting. So, be very careful if you have low blood pressure. And also be cautious with ginger if you are someone who is allergic to ginger. Nasser in I für in dein, Nasser shine, das Nasser nein. This is obvious and rare because there aren't many people who are allergic to this rhizome. If you have had allergic reactions, it's better to avoid ginger to prevent complications, okay? Share this video if you liked it. See you tomorrow morning. Bye bye.